Many parts of the country experiencing sweltering heat. When the mercury soars, heat illness certainly becomes a danger. Cleveland Clinic's Dr. Tom Waters says a heat emergency most common when temperatures rise and the humidity is high.
It creates the right environment for an acute heat illness, and that can range anywhere from heat cramps to what we call heat illness or heat exhaustion, all the way on the far end of the spectrum to something called heat stroke, which is an acute life-threatening emergency.
Dr. Waters says people at greatest risk for heat illness include young children, the elderly, and people exercising or working outdoors. He says feeling thirsty is the first sign of dehydration and possible heat illness. Other early signs include heat cramps, nausea, dizziness, and vomiting. If you notice any of these symptoms, it's time to cool down and hydrate. If you're spending a lot of time in the heat, he recommends taking breaks every 30 to 60 minutes and finding shade or air conditioning. For people who seek heat relief at a public air-conditioned spot, remember, protect yourself from COVID-19.
If you're going to a public place to get into the air conditioning, obviously it's important to follow all local regulations as far as COVID. And if you're out in public, you should be wearing a mask, you should be social distancing, you should be washing your hands frequently and avoid touching your face.
Those News 2's Carolyn Murray reporting. Anyone who seems confused after spending time in the heat should be cooled down immediately, taken to an emergency room. Confusion, a sign of heat stroke, which can be life-threatening. He says people should not be afraid to go to an ER because of COVID-19. Hospitals have put a number of measures in place to keep patients safe.